Hi, I'm Megan Hyun, medical physicist and assistant professor at the University of Nebraska Medical Center. And today I'll be giving you a virtual booth talk on our clinic's use of ClearCheck, a product from Radformation. So I'd like to start with a brief conflict of interest statement just to say that I'm not affiliated with Radformation and I am receiving a small amount of compensation for this talk. The primary goal today is just to give you a sense of how our clinic has used this product, why we're happy with it, and what some of the chief benefits are that we've seen in its use. So to that end, I'll start with a brief description of exactly what ClearCheck is, followed by our clinic's use of the product and the benefits that we've seen. These benefits can be summarized in these 4 points, and these benefits are sort of spread across the different uses that we've had of ClearCheck in the clinical environment. First of all, we use it for plan evaluation. This is our primary use of the product and was our primary motivator for purchasing it. And we've seen all 4 of these benefits listed for the plan evaluation usage, including ACR compliance improvements, standardization, safety and plan quality improvements, and increased speed. Secondly, we use ClearCheck to document aspects of the plan, and we've seen similar benefits for this usage. And finally, for plan checking, and I'll go into some of the benefits of this as well. Lastly, I'll give a demonstration of our use of the product and discuss a few final aspects at the end. So what is ClearCheck? ClearCheck, described on its website, is an automated plan check and documentation software. It's fully integrated into Eclipse because it uses API scripting. So this means for a mostly variant shop like us, we can easily integrate it into our workflows without adding a lot of document transfer and handholds between different vendors and products, which is a huge advantage, as you might imagine. So it's able to perform and document dose constraints, structure checks, plan checks, and prescription checks. And I'll go into a lot of these when I describe our clinical use of the product. So first I want to go over what our clinical environment looks like so you get a sense of what kind of environment we're integrating this product into with success. So at the Nebraska Medical Center, we are a mid-sized academic center, and we have 3 sites. One, which is shown in the beautiful picture here, is the Fred and Pamela Buffett Cancer Center in Omaha, Nebraska, and we have 2 satellite clinics. All 3 of our sites use ARIA Record and Verify and Eclipse treatment planning for external beam. Our faculty includes 16 members, 8 of which are radiation oncologists and 8 physicists. And as you can imagine, as these groups get bigger and bigger, you have more cooks in the kitchen and more opinions on how to evaluate and document your plans. So ClearCheck has been a way for us to standardize across all of these brilliant but sometimes disagreeing minds. We do a number of special procedures, including SRS and SBRT, and we treat around 120 patients per day across all of our sites. Our motivations for purchasing this product were, first of all, workflow improvement. For the last 5 years, maybe more, we've had a long-term project trying to improve clinical workflows throughout the department to improve work-life balance, satisfaction within the department, and quality of care. Secondly, we had a couple notes from our ACR site visit a couple years ago where they offered some improvements that we could make in our clinical practice, and ClearCheck was able to help us with some of these. Thirdly, we've seen an improvement in safety and quality in our patient care. This is a motivation for all of us who work in patient care, obviously. And lastly, it's helped us with our research needs. So we've started looking recently into adaptive radiotherapy, and in order to perform adaptive assessments or create adaptive plans, you need to do a lot of dose analysis. And so ClearCheck has been a tool that's helped us with quick analysis of lots of treatment plans for our research purposes. So as you can see, ClearCheck has helped us to check some of these motivations off our list, which helps us focus on further goals within the department for more improvements. So this is an image that's taken directly from the website where you can find more information about ClearCheck, and it just shows the different types of constraint checks that ClearCheck is able to do. And this was our primary motivator for purchasing the product, was the ability to do plan evaluation and to document that we're meeting or not meeting our dose constraints that were set at the time of planning. So the different types of constraint checks that are available include volume constraints, dose constraints, maxima, minima, conformity indices, dose spillage, and more. These are very customizable in different templates, as you'll see on further slides. And as you can see at the bottom, those 4 chief benefits that I mentioned are all being realized through our use of these constraint checks and being able to document them in a consistent way for all of our patients. So here's an example of what these constraint checks look like. You can see I've loaded a head and neck template, so I have lots of constraints for PTVs with dose painting, and I have plenty of OARs as well. I can very clearly see in this column in green which ones are meeting the objectives that I've set. And the physician can even come in and check off ones that are not meeting the objectives that we set with a timestamp signature. So that's a huge advantage of this system as well, is the ability to document the physician's approval on particular objectives. And that's for our clinical practice, but we've also benefited in our research practice from the use of ClearCheck. So as I mentioned, we generate a lot of plans in this research. So you can see our workflow shown on the left here. We're creating a lot of images, calculating dose on these images, and then trying to evaluate fraction by fraction doses for lots of fractions for lots of patients. And so in order to analyze these fraction by fraction doses for all of these adaptive plans, we needed a tool that was able to quickly analyze the DVH and give us a result fast. You can see here on the right, we have a composite analysis out of velocity, but not necessarily a fraction by fraction analysis. And that's where ClearCheck has come in for us. So you can see here, once we've created this adaptive plan based on the deformable registration between the planning CT and the cone beam with Hounsfield unit corrections, we need to be able to analyze this plan and compare to the original objectives. So I've loaded a research template here, and I can very quickly see which of these constraints are still being met for the research plan, the adaptive plan. So it's given us a really quick analysis tool for research usage as well. The second use that we typically use ClearCheck for is plan documentation. And our needs are actually kind of limited in this respect. So here's an example of a plan document that we pull from ClearCheck and include in the patient's record. So we would document those dose constraints that I showed before and a 3-field view of the patient's isocenter. So this is the main need that we had in terms of documentation, but ClearCheck is able to do a lot more than this. You can include lots of patient information, shifts, plan checks, DVHs, and additional images if you desire. So these options are very customizable, which is really nice. So even with our limited use of the documentation capabilities, we've seen improvements in standardizing these documents across all of our patients, increased safety and quality by allowing this quick isocenter check right before treatment, and following the ACR's recommendation to have these objectives printed out for each patient. The third main use that we have for ClearCheck is plan checking. And so a lot of physicists watching this presentation will attest second checks are not our favorite part of the job, but very necessary. So this table is taken out of TG 275, a recent task group that describes effective chart and plan review. And you can see that they've listed out some of the major failure modes using a TG 100 type analysis that you might see in plan checking. And so 3 key items that I've highlighted are problems with contours or the prescription. So these are some of the highest ranked failure modes that are listed in this task group report as things that can potentially go wrong and perhaps not be detected. And so it's really important to keep an eye out for these and make sure that they're not happening in your clinic. In our practice, we have done some incident learning to analyze where we tend to find errors and what frequency of various types of errors we tend to see. So here you can see that our second checks are our primary error catching task for our physicists. And on the next graph, you'll see that if we break down all the different types of errors that we're seeing, ClearCheck can actually help us with some of these. So of the 6 highest ranking errors that we find among our plans, we see that plan documentations and prescriptions are in the top 2. or in the top 6, excuse me. And so just like the TG275 graph showed us, prescriptions are an important one to look for in second checks. So if ClearCheck is able to do prescription checks as well as standardize our documentation, this can help reduce these errors that we tend to see. And another one I'll highlight on here is contours, which was also mentioned in the TG275 table. And so because ClearCheck does some structure checks, it can also aid us in reducing this error count as well. So the next thing I'd like to do is show a brief demo of our clinical use of ClearCheck. So you can see that I've loaded a head and neck patient in Eclipse, and I can just click a keyboard shortcut to get into ClearCheck from Eclipse. So it's really quick. And then you can see I've loaded a head and neck template here, and I can easily see which ones of my constraints are being met along this green line of checks. And I've prioritized my PTVs by placing them at the top of the list. If I scroll down, I see I have a few constraints that didn't meet the objectives that we set, but the physician has already come into Eclipse when reviewing the plan and checked off each of these objectives with a timestamp signature. So I can quickly see that the physician is okay with this. And then if I want to change any of these constraints, I can go into the template manager and I can modify the template that's been loaded or choose a second template, a research template that I've also loaded for this patient. And then I can add a constraint to this list. So for example, if I want to add another constraint for PTV1, then I would choose what type of constraint I want to add. In this case, I'm going to add a gradient measure. And then ClearCheck will tell you how to format the constraint in the upper right. It's actually hidden behind my face, unfortunately, but you get the picture. So I've added a new constraint, and I can exit out of the template manager and see whether that constraint has been met by loading that template I was editing, and we can see that yes, the gradient measure is being met. So it's very easy to edit these templates, to customize them exactly how you see fit. You can see I'm checking off a couple of objectives that weren't met in the research template. You can also see the DVH here, which we don't personally print on our plan documentation because it's already printed in the Eclipse plan, but I could see people wanting to use that as a customizable option as well. And then you can see the prescription and plan check templates that I've loaded. So this shows that we're doing a number of checks on the prescription that are really easy to see if they're being met or not in green and red. And then when I'm doing my physics second check, I can come in and load this plan check template and see a lot of aspects of the plan and whether they meet the expected values. And because this template is customizable, I can choose what those expected values will be when I'm setting up the template. And then if I want to print a report, I just hit the report button. You can see for us, it just has those 2 items that I mentioned. So we're just printing dose constraints and a 3-field view of the isocenter. But if you wanted to add structure checks or collision checks, a DVH or other items, you could easily change your print template to add those here as well. So again, this is really helping with standardization and safety and quality for our patient care. And then I just wanted to touch on a few additional aspects of our use of this software. First of all, there are lots of other tools that we're not using. Some of those include structure checks and collision checks, which I can imagine being very helpful. We just haven't implemented these at our clinic yet. It's very easy to administer. So you can add users as administrators and then build all sorts of templates for those plan checks that I showed, the dose constraint templates. Anybody can add these as they desire. So it's very customizable and easy to use. Our residents have benefited from it as well. So additionally, we have a really positive working relationship with Rad Formation. They're very communicative, willing to answer questions, and they have a lot of other products that we're interested in, but I'm not talking about here, like ClearCalc and EasyFluence. So I'd encourage you, if you have some time with your vendor reps during the meeting, please ask lots of questions and reach out to the company for more on these products. I really want to thank you for your time. And to conclude, I'll just say, again, ClearCheck is an automated plan check and documentation tool. It's fully integrated into Eclipse, And our clinic has really enjoyed using it, and we've seen a lot of benefits in both clinical and research practice. You can see my virtual business card here, so feel free to reach out if you have any questions specifically for me. And with that, I'll sign off and thank you.